Hi, everybody. Alexia and I welcome you to our podcast, and we're continuing a real exciting series on how to have more energy. How many of you out there would like to have more energy? I remember 50 years ago at Baylor College of Medicine, we had 24/7 a pot of black coffee brewing all the time for more energy. Well, I feel I have more energy now, many years later, and so does Alexia, than I had when I was over at Baylor. So, what are some of the secrets of having more energy? And I'm sure everyone in the world today would like to have more energy. So, is a quick review of last time is the famous astronomer that everyone knows, Carl Sagan. His wife was a genius. Her name was Lynn Margulis, and what she showed was the energy factories that we have are actually morph bacteria. That's an incredible insight in the history of medicine and science. And they're called the mitochondria. Okay, for those of you tuning in for the first time, they're the little energizer bunnies which give us the energy of life. And a hot topic in medicine today, one of the biggest hot topics, is it's called mitochondrial biosynthesis, fancy term for making new mitochondria. Okay. And is when you do exercise, there's two types, aerobic and anaerobic. And Dr. Ken Cooper coined the terms when he was training the astronauts for the moon landing in 1969. And aerobic is just what it says. Thank you, Dr. Cooper, is the continuous intake and use of oxygen. For example, when you take a nice brisk walk, okay. And the other type of exercise is called anaerobic, just what the name says, without oxygen. That means that Mother Nature gave you the capacity to get energy in the absence of oxygen by burning glucose. So aerobic, anaerobic, and it's known in the medical journals that one can increase their mitochondria by up to 300%. That's a threefold increase in energy. That is a lot. Well, today I'd like to share with you this. This is really exciting and interesting. A Nobel Prize was given for a new neurotransmitter, and it's a gas. Most of them are chemicals, okay? This is a gas, and it's called nitric oxide, not nitrous oxide, which is the laughing gas in and used in dental offices and sometimes for recreational purposes. This is nitric oxide. Well, when a Nobel Prize is given in medicine, that is peer-reviewed and that's top of the line. So nitric oxide, the gas, what does it do? It dilates the blood vessels. That's good. Vasoconstriction, which is roughly synonymous with high blood pressure, well, we all know that story. So what you want in your aerobic exercise is vasodilation to facilitate blood to your heart and, of course, your leg muscles, which constitute 70% of the body musculature. So you're getting a lot more blood there, a lot faster when the blood vessels dilate, okay? And of course, just, the obvious blood going to those regions. Well, guess where the main repository of nitric oxide is? In the back of the nose. It's called the nasal pharynx. So the takeaway that Alexia and I would like to give you today is by nasal breathing, you will release the nitric oxide, which will dilate your blood vessels, and get a lot more oxygen where? To your mitochondria, okay? Because the mitochondria absolutely need oxygen. Whereas if you're doing strength training, you could actually burn glucose without oxygen. So nasal breathing is so important. And I kid you not, a British doctor was actually investigating the effects of nitric oxide for obvious reasons, to relieve high blood pressure, things like that. And this is serious, this is no joke. That's how Viagra was actually discovered. So the take home for today, in short, from Alexia and myself is do your aerobic exercise and please breathe through the nose, which also warms up the air for your lungs in the wintertime, okay? And when you breathe through the nose, you'll also get an additional benefit because the whole lining, down the pike, the trachea and all that are lined by cilia, little hairs which bead upward to keep out pollution, bacteria, and viruses. So we're going to continue our exciting series on how to have a lot more energy, which everyone needs. And we will also do a lot more energy with regard to nutrition, especially the important B vitamins. So again, Alexia and I, thank you so much for having us, and we will look forward to seeing you tomorrow. Have a great day, and thanks again. Bye-bye.